In Zimbabwe, more than 74,000 children and adolescents are living with HIV. Antiretroviral medicines are life-changing for those infected, but treatment alone is sometimes not enough. AfriCAID, a community-based organisation, runs a programme led by adolescents, all of whom are living with HIV themselves, who support other young people with an HIV diagnosis and help them lead happy and healthy lives.
Pandikaziva status yangu ndakanotestwa kuchipatara nanesi ndikanzi nda HIV positive. Panguva yandikanzoshatirwa zvisingaiti ndikasazvigamuchira zvokuti mundangariro dzangu ndaigara ndichinetseka ndichitongoti upenyu hwangu hwaguma handina zvimwe zvandichakwanisa kuita sezvo nda HIV positive. Asi pandikazowana rubatsiro kubva kumaCATS ndakakwanisa kunatsogamuchira status yangu kuti zvinhu zvinowanika mukurarama. Pari zvino mundangariro dzangu hamusisina na zvinetso zvinondinetsa. Pane zvese ndakutofunga mune zvakanaka, mishonga yangu ndakunwa zvakanaka, utano hwangu kunatsoendeka mune zvakanaka. Pasina na dambudziko.
Just like Leosa, there are 74,000 adolescents living with HIV in Zimbabwe. With ARVs, it means they're now growing up into adulthood and living healthy, normal lives. But young people's success on treatment is reliant on their ability to adhere to medicines every day for life. This is affected by many issues, including the death of parents and siblings, fears for their future, isolation, and feeling different from their peers. But hope is not lost, as a group of HIV-positive young people are on the front lines providing the much-needed peer support, known as CATS. One such young man is Maxwell, who has been living with HIV for the past 4 years and is passionate about issues others like him face.
It's an acronym which stands for Community Adolescent Treatment Supporters. And the CATS are peer counselors who work with the children, adolescents, and young people living with HIV, ensuring that they have the appropriate and correct information and providing them counseling they need to live happy and healthy and fulfill their lives.
The CATS work alongside the government healthcare workers, bridging the gap with young people and strengthening the national system and response to the evolving needs of young people living with HIV.
We started working with CATS, that is 2016. The CATS became a linkage. It has helped erase stigma. When they come for support groups, they were able to understand their own care and they were able to understand that they are not alone.
Young people living with HIV used to do much worse than adults on HIV treatment. But this has changed with the CATS program. The health facilities are finding that adolescents are managing to do just as well on treatment, and their mental health is also improved.
Patime yandikanga ndine mwana ndainwa mushonga sekutsanangudzoka ndaitwa kuclinic, but patime yekuti mwana akazorega mukaka ndakanga ndangoita yese ndangoti mwana nonga ndanga akakosha unza asaite HIV asaite HIV positive. But because ya markets ndikakwanisa kunatsochinja kunyaya ye-adherence saka ndikatanga kunatsotedzera.
This program has worked out very well. The adolescents now understand the importance of adherence, and we find that since then most of them had recovered very well.
Antiretroviral treatment can change the life of an adolescent living with HIV. But this medication alone is not enough. This is where the power of the peer comes in, where an adolescent living with HIV is supported by another adolescent living with HIV. Treatment works better in this regard.
To offer counseling about my issues avanosangana nawo mukurarama, mungawa muri munharaunda, my issues of stigma. Then pane issue we do my support group, facilitate my support group whereby my adolescents vanouya toungana to share my issues, to discuss my issues, my topics, my sexual reproductive health.
There are currently 1,500 CATS across Zimbabwe and another 500 in other countries in the region. If this intervention continues to expand to other parts of the country and region, the program could make a huge difference in adolescents living with HIV.
If it's expanded, it will be very helpful to all adolescents and young children living here in Zimbabwe. I think that would be very perfect if it's done.
There is an old adage that says, life is like a bicycle. No matter what you face, keep pedaling if you do not want to fall off. If the world adopts and values the contributions of the CATS, there is potential to stem the failing trends in adolescent HIV.